Hello and welcome to Chapter 5, Humerus and Shoulder Girdle. In this chapter, we'll discuss the proximal humerus and the shoulder girdle, which includes the clavicle and the scapula. So let's get started. Just as a review, remember the humerus is the largest and longest bone of the upper limb. The humerus articulates with the scapula, or the shoulder blade, you may hear it called, at the region of the shoulder joint. Okay, so kind of orientate yourself with this. On the next slide, we're going to really talk about specific parts of this proximal humerus. Okay, so again, the proximal humerus is the part of the upper arm that articulates directly with the scapula, and that makes up the shoulder joint. Let's identify some key parts. The most proximal part is the rounded head of the humerus, and you see that here. Okay, the head of the humerus. The slightly constricted area right below and lateral to the head is the anatomic neck, and that is really kind of a dividing line between the head and the greater and lesser tubercles. Okay, so anatomic neck here. The process directly below the anatomic neck on the anterior surface is called the lesser tubercle. Okay, so lesser tubercle is more of an anterior structure. The larger lateral process is the greater tubercle. And interestingly, you don't have to write this down. Two different muscles attach to this greater tubercle, the pectoralis major and the supraspinatus muscles. All right, next, notice in between the tubercles there's this deep groove or sulcus. That is called the intertubercular groove or bicipital groove. So this should say intertubercular. A little bit of a typo there. The tapered area below the head and the tubercles, okay, so again, a more tapered area below the head and the tubercles is called the surgical neck. And distal to the surgical neck is the long body or shaft of the humerus. The surgical neck is called the surgical neck because it's the site of frequent humerus fractures that often require surgery. Fractures at the thick anatomic neck are much rarer. All right, one other thing, let's talk about this deltoid tuberosity. That is a roughened and raised triangular shaped elevation along the anterior and lateral aspect of the body of the humerus. And all you really need to know here is that the deltoid muscle attaches to this deltoid tuberosity. So to recap, it's a raised and elevated prominence on the anterior lateral surface of the proximal humerus where the deltoid muscle attaches. One other thing I want to point out here is this diagram depicts the arm in neutral rotation. And neutral rotation is just our arm naturally at our side. Typically in neutral rotation, the epicondyles on the distal humerus are usually at a 45-degree oblique, but of course that's different for every patient. So in other words, neutral doesn't mean the hand is supinated, it doesn't mean the hand is pronated, it's just relaxing at the patient's side. Okay, this image is an anterior-posterior radiograph of the shoulder taken with external rotation. And external rotation places the humerus in a true AP position. So to achieve external rotation, look at the model here. You supinate the hand. The epicondyles are parallel to the image receptor. So when the hand is supinated, the epicondyles are parallel. Notice you get the greater tubercle in profile laterally, and this is a true AP. So A is pointing to the head of the humerus. B is that greater tubercle. C is pointing to the groove or the sulcus, the intertubercular groove. D is the region of the lesser tubercle. E is the anatomic neck. F is the surgical neck. and G is the body. So we're going to talk a lot about the greater and lesser tubercles. They're really important for us in determining the position of the humerus and the shoulder girdle. And in a true AP, the lesser tubercle is located anteriorly and the greater tubercle is located laterally, as you see here. Okay, the clavicle. Remember, the shoulder girdle is not just the humerus and the scapula. We also have a clavicle. So, the function of the clavicle and the scapula is to connect each arm or upper limb to the trunk of the body or the axial skeleton. Okay, so let me say that one more time. The shoulder girdle consists of two bones, the clavicle and the scapula, okay, in addition to the humerus. The clavicle and the scapula connect the humerus to the axial skeleton or the trunk of the body, okay? Anteriorly, the shoulder girdle connects to the trunk at the upper sternum. Okay, so the clavicle connects the shoulder girdle anteriorly to the manubrium or the upper sternum. Posteriorly, the connection to the trunk is considered incomplete because the scapula is connected to the trunk only by muscle. So there's no other bone posteriorly connecting the scapula to the trunk of the body. Okay. Further, each shoulder girdle and each humerus connect at the shoulder joint between the scapula and the humerus. So in other words, everything connects here. So the shoulder girdle and the humerus connect at the shoulder joint. Okay. Each clavicle is located over the upper anterior rib cage, and you can see that easily when you look at a skeleton. And each scapula is situated over the upper posterior rib cage. Okay. The upper margin of the scapula, so you can kind of see it behind the clavicle here, is approximately at the level of the second posterior rib, and the lower margin of the scapula is at the level of the seventh posterior rib, or T7. So guess what? You could use the bottom of the scapula to help you position for a chest x-ray, right? Because we center at T7 for our chest x-rays. All right, the clavicle is a long bone with a double curvature. And it has three main parts. It has two ends and a long central portion. So the lateral end is called the acromial extremity, and it articulates with the acromion of the scapula. That's why it's called the acromial extremity. This joint is called the AC joint or the acromioclavicular joint, and typically you can palpate that, depending on how muscular your patient is. The medial or sternal end articulates with the manubrium, so that's why it's called the sternal extremity. Remember, the manubrium is the name for the upper sternum. This joint is called the sternoclavicular joint or the SC joint, and can also be fairly easily palpated. Remember, the combination of the SC joints on both sides of the manubrium help form that jugular notch, and we also use that as a positioning landmark. The body of the clavicle is the elongated portion in between the two extremities. The acromial end of the clavicle tends to be flattened and has more of a downward curve until it attaches with the acromion, and the sternal end tends to be more triangular and is directed downward to articulate with the manubrium. Okay, just a couple more things about the clavicle. In general, the size and the shape of the clavicle differ between males and females, so please be familiar with the differences. The female clavicle is usually shorter and less curved than the male clavicle. And the male clavicle tends to be thicker and, of course, more curved. And we typically see the most curvature in heavily muscled men. Okay, good. So let's conclude part 1 by just doing a brief anatomy review. So this is an AP clavicle, and certainly we'll talk more about this in lab, but let's review the anatomy. So A is pointing to the sternoclavicular joint, so the SC joint. B is the sternal extremity, so the whole sternal end of the clavicle. C is pointing to the body of the clavicle. D would then be the acromial extremity, and E would be the acromial clavicular joint, or the AC joint. Okay, thank you. We're going to pause part 1 here. We'll pick up with part 2, learning about the scapula.